I am Dr. G.S. Lamba, Chief of Gastroenterology and Hepatology at Sri Balaji Action Medical Institute, New Delhi. Now, today we are going to talk about a condition which is very common and it is known in common language as piles and which we in medical language call as hemorrhoids. Now, hemorrhoids and piles is a disease which basically involves the anal canal. And the chief symptom of this disease is that there is blood in the stools. So this blood is a bright red blood. It usually is sprinkled over the stools, or sometimes after stools there is a dribbling of blood. So this is a typical symptom of piles. Besides that, it can also present as pain sometimes when there will be pain in the perianal area, especially during or after defecation. Then it can sometimes also present as fever or something when it gets infected. But the main symptom remains as bleeding per rectum. Now, piles is common in certain types of people. It is more commonly seen in people who are overweight or who are obese, and weight is a risk factor for development of piles. Then it is also common in pregnant ladies. A lot of pregnant ladies during the course of their pregnancy will develop these hemorrhoids or piles and will have bleeding per rectum. Other risk factors include prolonged sitting or people who do long distance driving. They are also prone to development of these piles. Now, piles is not a very serious disorder. It can be treated very well. For diagnosis, we can put in a camera from below and we see that they are there, and then we can give the treatment. The initial treatment is generally one to cure constipation if it is associated. And secondly, we give drugs to control the bleeding. We have certain medications which can help in control of bleeding. If the patient improves, it's okay. But if the patient does not improve and continues to bleed, then we consider the patient for surgery. It's not a very big surgery. A small surgery can take care of piles and it is like a permanent solution for it. So remember, whenever you have bleeding from in the stools, you should always consult the doctor. One of the commonest causes of this bleeding in the stools is piles. But a word of caution, people start treatment of piles without getting properly diagnosed. That should never be done. They believe that every bleeding in the stools is due to piles. It's not. So always consult a doctor whenever you have a bleeding and he will diagnose what is the problem and treat accordingly.